Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. As you can see, I just took my mask off. Remember, masks are very valuable to you. And by the way, they don't carry a political lineage. They are protected for you. Anyway, I will put my mask down here. Everybody in the studio's masked. Let me go to the subject matter. For many years, as I always tell you, this program is really driven by the requests of the viewers, and we've been doing it for well over 22 years, so you've been giving us pretty good questions. And the three top areas have always been cancer, heart disease, and believe it or not, minimally invasive surgical techniques. Today, we have the privilege of having the Cancer Survivorship Program representatives from Sylvester, which is obviously one of the nation's premier cancer therapy and I should say the whole modality of cancer treatment. So let me start out by introducing Dr. Frank Penedo. He's the director of the Cancer Survivorship Program Center, and you're associate director of the Cancer Survivorship and Translational Behavioral Sciences. That's a very long title.
It is. Thank you.
Good to see you, sir. Tell us from the very beginning, what is the Cancer Survivorship Program?
Sure. So first of all, thank you for bringing us to your program and giving us the opportunity to talk about this really very important topic that's near and dear to us in the work that we do every day. So this concept of survivorship, it's a relatively new concept in oncology. It's probably dates back to the 1970s, but it gained a lot of traction about 20 years ago or 15 years ago when the Institute of Medicine, now the National Academy of Sciences, started really raising awareness about the fact that while we were doing great strides and progress in early identification of cancer and advances in treatment, we weren't doing such a great job at working with the patients once they completed their primary treatment. And that's where survivorship and survivorship care really comes into focus. Just to throw a couple of numbers out there, currently there's about 20 million survivors in the United States. That number is expected to reach 26 million by 2040. The number keeps growing as we continue to develop early detection and treatment advances. And while this is great, people are now dealing with cancer as a chronic and manageable disease. There are challenges that come with that. Some of the challenges are treatment-related side effects, which can be chronic and debilitating. Care continues to be complex. There's many new treatments that are very efficacious, but they're delivered across different disciplines with individuals with different levels of expertise. We also have a problem where we are running out of oncologists and primary care providers that are well equipped to deal with this growing number of the cancer survivorship population. And also very important to us is that many of these patients have unmet psychosocial needs, ranging from the anxiety and the distress from the day of diagnosis when they're told they have this chronic condition, to determining how they're going to receive treatment, making treatment decisions, undergoing active treatment, experiencing the treatment-related burden and symptoms associated with radiation, with chemotherapy, and so forth, and then having to go back into their daily roles as a mother, as a father, as a co-worker. These challenges don't disappear. They're still there. And another huge challenge that our patients have is the financial burden that comes with a cancer diagnosis. So what survivorship does, it works with our patients once they've completed primary treatment to help them adjust as best as they can and to help us optimize their quality of life despite these challenges that they're going to be dealing with.
Let's talk to Dr. Carmen Calfa, who is a breast medical oncologist and a researcher. And it certainly is the most talked about issue that comes to us, Dr. Calfa, is research. So Talk to us about being the medical director of clinical operations that's associated with the Cancer Survivorship Program.
Thank you so much for having us today and for sharing our feelings, our thoughts, our programs with the community that you represent. I couldn't appreciate more the opportunity to really share with the survivors that are listening and watching us how much we really want to make this journey of a cancer survivor the best and the longest possible one. And you said research is something I'm really passionate about, and that's one feature that every practicing oncologist and hematologist at the cancer center, it's a scientist and a physician, a practicing clinician. And that's what makes Sylvester really special. And I think one of the NCI accreditations, and now you know that we're the 71 accredited cancer center, and we're the only one in South Florida, really looks for us to not only practice oncology on a day-to-day basis, but also bring the newest ideas and the most scientifically sound concepts and try to see how we can expand from really the very early lab in a mouse or in an animal model or even before that to really expand it to a phase 1 clinical trial, then a phase 2 and a phase 3. So I'm going to talk about research. We have several phase 2 clinical trials that are conducted throughout the network that we have at Sylvester, and that's including the Miami and then the Tri-County area. And we're really looking to expand into patients that are all the way south and all the way north to us, and there are people that come from other states as well. I am the clinical investigator for many of those studies in breast cancer. I'll just name a few of those trials that are ongoing. And I know people are really looking, even though we have such a hesitancy in using vaccines for COVID now, I think when it comes to cancer treatment, it's been long sought after to use the immune system to really help beat cancer or prevent the cancer recurrence. So for triple negative breast cancers, we have a vaccine trial where upon completion of the treatment, patient is offered to participate in a clinical trial that potentially could engage a vaccine. And that's just to make the cancer cells that are potentially left after in somebody's body recognized by the immune system and then have the immune system do the rest of the fight for you so the cancer never comes back. So that's one of the phase 2 studies that we have in affiliation with the Mayo Clinic, and we have patients coming from out of states. And it's really rewarding to see hundreds of patients have gone on that study, and we're anxiously waiting to complete the study accrual and then hear the results.
Tracy, let me introduce you. You're the co-leader of the Cancer Center and a Control Research Program. So what do you have to say?
Well, I think, I am a new recruit to Sylvester Comprehensive Cancer Center, and I'm excited to be here. One of the big draws for me to come here was the dedication to survivorship. And Dr. Calfa and Dr. Penedo have started up wonderful clinics in survivorship that are comprehensive from not just the treatment you receive, but the care you receive afterwards in terms of your lifestyle behaviors. So my focus in my research is on healthy diet and eating and physical activity, and how these can help not only reduce your symptoms during treatment, but also hopefully reduce your risk of cancer later on down the road. And so the big draw here was because it was comprehensive to come to Miami and work with such an incredible team that really values the whole picture and the whole care of the person, not just the disease itself.
We're blessed in having a certified center here in the state of Florida. Now we have 2, but the bottom line is what I'm saying is that as a co-leader of the Cancer Control Research Program, I can tell you that most of the questions that come from the people that are watching are based upon fear and pain and death. Now, that's not a very nice statement, but it's a true statement. So let's react to that, if you don't mind. I'm going to start off again with you, Tracy. Dr. Crane, go ahead.
So I think that while cancer is a hard diagnosis to face, treatments have come a long way, and I think there are things we can do. One of the things that patients tell me personally when I'm working with them, either in research projects or individually, is that you have a loss of control. So working from the lifestyle behavior side of things, being able to control something so you can control how active you are and you can control what you're putting into your body. And so my goal working with patients at that initial time when you're talking about fear and the diagnosis is what can we help you with? And these are good things that all of us should be doing, but that can help people. And sometimes we hear, especially in the behavior modification field and in cancer control, is that cancer can be a teachable moment, right? A time when people are suddenly at a crossroads where they want to change certain behaviors that hopefully can help prevent cancer. And it can be a family affair. Oftentimes we see the whole family gets involved with adapting to these new and, adopting these new lifestyle behaviors. So I think while scary, there are things that can be done to help make it a little bit less scary that are in people's control.
Dr. Penedo, to that end, I would assume, as a director of the Cancer Survivorship Program, that it has changed dramatically over the last, I guess, decade, and maybe even a shorter period of time, because there's more intent by the general reporting public and the opportunity to understand that cancer, and I don't mean to be very dramatic, it's not a death sentence. It's something which is a disease that can be survived. And therefore, you as a director of the survivorship program must deal with some of those feelings when they come into the program. Is that right, Dr. Penedo?
That's absolutely correct. So we have seen, if you went back to the 1970s, individuals had maybe about a 50% chance that they would be alive 5 years after a cancer diagnosis. That number has increased to 70%, and that's a very significant increase from an epidemiological perspective. We also see patients, particularly early stage breast cancer, prostate cancer, and even now with lung cancer, who are living longer, and in fact, they're not dying from cancer when the time comes. They're dying from cardiovascular diseases due to either diabetes or hypertension that doesn't get controlled. I do want to go back to the concept about this fear and this death sentence, and that is to be expected. I think that we have to understand that when somebody gets diagnosed with cancer, no matter how much our experts and clinicians sit in front of them and tell them, you're going to be able to fight this, the survival rates are great, there's new treatments, it is completely expected that these individuals are going to go through a very hard adjustment period where they really have to evaluate their lives, their health, and the outlook. But fortunately, most patients tend to do relatively well in terms of that fear and those emotions. It is about a 30% of our patients where we see these complicated reactions where psychosocial services and support services come into play. And I think also something that it's important to highlight is if you look at us, we reflect what survivorship truly is, which is a multidisciplinary, comprehensive approach. I'm trained as a clinical psychologist, so obviously my emphasis is in psychosocial oncology and dealing with emotions, with social processes. Dr. Calfa, as she's so nicely presented, is a clinical clinician, a medical oncologist with a very strong emphasis on researching therapeutic treatments. And then we have Dr. Crane, which complements us by her emphasis in lifestyle factors like working with nutrition, physical activity, obesity, and other factors that we know that complicate the cancer experience. So I think the message is that it is normal and it's expected for patients to have these adverse reactions, but with the right care in place and the right treatment, we're here to help them deal with not only the fear, the anxiety, but also from the medical and lifestyle perspective of their disease experience.
Dr. Calfa, with reference to what Dr. Penedo just said, it must be very interesting, particularly at this time where all of a sudden the public has become much more cognizant or focused on on a disease because of this insidious virus that we're dealing with right now. But there is a bright little side to it in the fact that just what Dr. Penedo just said, we have an opportunity now to talk to people about the issues related to the areas such as nutrition, to the psychosocial issues. I mean, look at how all of a sudden now the big battle is how are children being affected by not being in school, or how are people affected by working at home. These are psychosocial issues that are far removed from the cancer survivorship program, but in essence, if I'm not incorrect, I believe they're the same issue.
You said it right. I think COVID just added another layer of complexity to an already complex story. And everything was said today is just so true. And I'm going to just talk about a second for those that are feared that, right? So I think we all fear that at times, but I think what people are more afraid of is dying in pain and not being able to express their wishes and not having their goals, met. And one thing that we do really with the team that we have in place, we really sit down with every individual and we try to understand their goals in life, and we try to understand where the fears are coming from and try to really go deeper into understanding. And once you do that, you actually break up a puzzle that is so complicated, and you start giving them solutions, and their fears go down and they become your partner, or you become their partner in really achieving their goals. And I'm going to say that survivorship now includes the ones that are living with advanced cancer. So it's not only those that are treated with curative intent, but those living with advanced cancer of any kind. And that's why Dr. Penedo mentioned that we have so many survivors and the number is growing. In breast cancer, we improved by 40%. The mortality had gone down by 40% in the last 3 decades. So I call cancer the gift that keeps on giving, because it really affects the individual and the family and the caregiver and everyone else from head to toe. And it's literally from head to toe, right? From the hair. And you don't know how much the hair means to anybody. For some people, they couldn't care less of losing the hair, growing new hair. For some, it's the end of their life. And they're not going to take chemo unless you fix the hair. So we really have everything we need in our hands to really customize and personalize that treatment for everyone that comes to the door and meet their goals and help them to set their goals. And I'm just going to say that you ask, how is this with COVID and, their family and the socioeconomic and everything else that have come into play. We're able to really keep the clinics open. And even though the caregiver wasn't allowed in, we're able to really connect with them on FaceTime or anything else. And the survivorship services and care was continued to be provided on Zoom and on one-on-one with patients. So we're able to really engage with them at a time that they needed it more. And I think that made a huge difference for our survivors.
Tracy Crane, you're the co-leader of this Cancer Center Control Research Program. What's your sense of how things are moving along, even though we're battling this, shall we say, unbelievable, insidious pandemic, which takes up all the time on television and newspapers?
I think that we've had to start to adjust to think about this as a new way of life, unfortunately, and begin to make adjustments to living with this virus. And so beyond taking the safety precautions, I think there was a time period, especially in the beginning of the pandemic, when people weren't coming in to get screened, right? So for cancer prevention and for cancer control, that's important. So it's important to remind patients and people everywhere that they need to return back to their regular screening. So we've seen a dramatic decrease in the number of screening for mammography and colonoscopies. And these are important things to get back to, because unfortunately, this is the way we're living. So I would put the message out there that we need to get back to screening in your regular routine doctor visits. In terms of a lifestyle behavior space, that is my personal research interest, I think, again, we all learned how to make sourdough bread at home at the beginning of the pandemic, right? That was the big thing, is that we all took on these, and it's comfort, but again, we have to adjust to this new norm and get back to, a lot of us some people, about 50% of the population, it seems like really got into this big health kick and embraced exercising at home and being at home. And another portion of the population really let it slide. We know that alcohol consumption is up overall as a nation, and that's important to address and to begin to think about what we can do to help get the message back out that those more unhealthy behaviors can't continue to go on as a comfort during the pandemic, right? So we've got to get back to the way to a new normal, but back to our healthy behaviors, including screening and including prevention services.
Dr. Penedo, I really was very pleased to hear you bring up the issue of the psychosocial issues. And we get a lot of comments about nutrition and the intake of fluids. I know it's sort of oversimplistic talking to these fine physicians and PhDs that are involved with research and care, but I guess that must be a subject matter which is very prominent in the survivorship programs.
Absolutely, and I'm glad you brought that up. So we do have a program in place where we assess our patients' needs when they're coming into our visits. So we ask them about how they're feeling regarding their emotions, if they're experiencing pain, difficulties with physical functioning. We also ask if they have challenges with any practical needs like transportation and childcare. And then we have a nutrition assessment. And the nutrition need or the request by our patients to be seen by a nutritionist is the most widely endorsed need that we have in our cancer center. 40% of the patients that we endorse tell us that they need help with nutrition and they want to talk to a nutritionist. Now, it's not surprising. If you look at the general population, you probably get a big percentage of trying to understand what is the proper nutrition. Is fasting a good thing? Is a keto diet a good thing? But keep in mind that these are patients that are going extraordinary circumstances. And, even as a psychologist, when a colleague or a friend tells me they've been diagnosed with cancer, what do I recommend? I tell them, adhere to your medical treatment, proper nutrition and physical activity, and then let's talk about managing your stress and your psychosocial needs. So I even put nutrition above psychosocial management because it's just such a key component for the health and the well-being of our patients. And it is one of our most endorsed or the highest endorsed need of the patient population that we see.
Where are your centers? I know, for example, here in Broward County, I know of one in Hollywood and Plantation. Where are they?
So we have a central location, which is obviously right next to Jackson. And then we have 9 satellites. I'm losing count, we keep expanding, but I believe right now we have 9. We have one in Plantation, one in Deerfield, a Ventura, which is in Miami-Dade, but close to Broward. And then we have several throughout Miami-Dade and Palm Beach as well.
There is one in Coral Springs. So if you go west of us, so we try to really go east, west, north, and south. So the Broward has the Coral Spring, that's the west one, the Deerfield. We have some Ventura that was most recent, Hollywood and Plantation. And then south, you go all the way to the Coral Gables with Eleanor. We're opening one in Doral as well. So.
And patients coming into these centers will have access to a nutritionist.
Mm-hmm.
So Dr. Crane is our research arm that oversees best practices also for nutrition and lifestyle factors. But then we have on-the-ground nutritionists who will work directly with the patient to help them with their needs.
Thank you. Well, we're down to the last minute and 10 seconds of this show. So I'm going to say thank you to the 3 of you who are really, you're the heroes and heroines of the fight and the survivorship of this really devastating disease called cancer. So Dr. Frank Penedo, Dr. Carmen Calfa, and Dr. Tracy Crane. Thank you for not only your work, but for your, I guess, your willingness to show the human side of healthcare. And I think that when we, as healthcare providers, when we look at a patient and you realize that they are really us, and how would I like to be treated, it gives a different view. And what I've heard today sounds like you hit it right on the spot. So thank you very much, Dr. Penedo, the director of the Cancer Survivorship Program at Sylvester, and Carmen Calfa, you're the breast medical oncologist. And again, I invite you to communicate with the AutoNation Research Center here at NSU, and Tracy Crane as the co-leader, and certainly the cheerleader as well, of the Cancer Center Control Research Program. Thank you all for participating. I'm very excited to the fact that we finally got a composite group of people from the Sylvester Cancer Treatment Centers because it's a very important thing. You're an important part of the fabric of not only our community, but the community of healthcare. Thank you, all three of you, for being here today. We appreciate it. Folks, as I always say to you, this program is yours. You ask questions, we try to get you answers. We don't give you the answers, but we have a telephone number and an email address right here. If you want to offer any comments, we'll pass them on to the group that has just presented, Dr. Penedo, Dr. Calfa, Dr. Crane, and they'll be able to lead you in the right direction. So this program is called Dateline Health. We come to you from Nova Southeastern University. And remember, I always tell you, you got to tell your doctor everything that you do, including what you go when you walk into the supermarket and the pharmacy, and take medications to mitigate what you think is your treatment. But let them know, because your health care is in your hands as well. This program is called Dateline Health. We come to you from Nova Southeastern University. Until next time, see you.